So basically, I'll be talking about evaluator's expectation at the final clinical evaluation. So as you know, in your final clinical evaluation, there's two sections, one's research, one's clinical. So I'll be talking about the clinical part. Your clinical part evaluation is part of formative assessment. Just to give you a basic, is basically an in-training measure of your development. Okay, and define the areas of the improvement. What we're looking out for is actually cumulative assessment, whether it is poor or it will be good. Now, just to explain to you what are the components of it, before I tell you what are the things to bring, which you should know by now, these are the tools which we use, okay? Things like your work-based place assessment, logbooks, case write-ups, and also portfolios. Portfolios meaning logbooks. So as you know, sorry, portfolios meaning things like your courses and all this kind of stuff, all right? So these are your workplace-based assessment. So these are the things which we measure the ability for you to apply your skills and knowledge, where we look at a few things, reliability, validity, educational impact, acceptability, and also feasibility. And we use various measures in order to assess your workplace-based assessment. And all of it, so far, we do not have anything structured to say that we do dots for this, you know, mini checks for this. But we do it in a variation whereby at the end, all of you who go through each posting we will need to fill up this form, okay, where we will, through the supervisors and to the trainers, they will look at your aptitude and your attitude to training. They will look at your knowledge and also your education. They will look at your clinical skills, responsibility and professionalism. And then later on, we will decide on your overall performance to see whether you fulfill the requirement or not. So during your final clinical evaluation, we will look through and see whether you have actually satisfactorily completed all of these postings. Okay. Now, if you do not satisfactorily complete the posting, and there are actually recommendation for you to extend, okay, so that will be one of the reasons why we will may need to take action on you. Of course, looking at the recommendation and also the reasons why. How about logbooks? Now, most of the time, most of you don't have any problem with your work-based assessment form here. Well, I noticed that most of you have your problems with logbooks, okay? Now, first of all, please come with proper logbooks. I find that a lot of you come with incomplete logbooks which lack complete information. Some of you do not come in with consolidation sheet. I think for a person coming in for final clinical evaluation, this is really not acceptable. Okay, you guys going to be surgeon, the format has been given to you initially, and you still come in without any proper format. So there should be a new rule coming out to say that if you know, prior to coming to your final clinical evaluation, you need a proper logbook. Okay, and the logbook should have all of the information inside. Okay, I will show you what is the context and also the format we're talking about. So before I go into that, give you an example of logbook. These are the skill levels. Most of you have your own format. You know, you all simply put skill level 1, 2, 3. But these are the actual skill level which is recommended. Please take note. Okay, so basically, let's just say case which you have seen. Okay, if let's just say you have observed, those are the descriptive equivalent. Put 2. All right. If you manage the patient with part with assistant, please put 3. You can manage but need some assistance, then please put 4, 5, and so forth. Okay, it's unlikely you'll be able to hit 6 unless you're talking about things like appendectomy or even abscesses. Huh? This is the example of your logbook. All right. Okay, you're supposed to have your trainee's name there, your ID, your year of your level, your rotation, which was the period of your rotation. For example, if you were in HPB, it's between what week, what day to what day. You need to put the patient's name, age, registration number, diagnosis, the procedure, and also the level of skills which you are involved in. All right. And this is the example of your consolidation sheet. Okay, you're supposed to tell us how many cases that you did and what is the surgery that you did and how many cases that you actually do. Now, some of your colleagues actually break it down very nicely into the posting. You can do that too, okay? But be mindful that you must have a consolidation sheet. It's very difficult for us, especially at the last clinical evaluation, to look through all of your logbooks. So one thing that also irritates your assessors and evaluators at the end is you do not have a proper consolidation sheet. Okay, I will show you an example later. Okay, moving on. So after you have proper, you pass all of your postings satisfactorily, all those, the assessment form, you have a proper logbook. I will show you the requirements for the logbook later. Okay, then you will need at least 3 case write-ups in surgery. Okay, those 3 case write-ups must include literature review. They must be signed and verified by consultants. Again, we are getting reports which is not verified by consultants and not countersigned by consultants. And we encourage you to publish it, these case reports, or even present it into meetings. Okay, not compulsory, but we encourage for you to do so. Finally, is your CPD portfolio. We want to see you have some kind of continuous professional development. It is divided into A1, A2, A3, A4 as like how your CPD is supposed to be. But this is what is mandatory and what is recommended to you. Now, in the future, mandatory will be science of tissue management as well. SOTM, I did not include this. Okay, so mandatory for you now will be things like ATLS, CRIPS, NOTS, and also gastrointestinal endoscopy course. We also recommend other courses like basic lab courses, hernioplasty, things like cholecystectomy. We hold at least once or twice a year, so you definitely will get that. Anastomotic, mastectomy, thyroidectomy, workshop, and so forth. Okay, you must have the mandatory one, and we recommend you to have those which are recommended. When we assess all these things, these 4 items, your case write-up, the CPD portfolio, your logbook, and as well as your assessment forms, we will then fill up this form at the end. Okay, this form is usually filled up, is usually checked by 2 or 3 trainers. Okay, and we will look at all of these 4 components and see whether you satisfactorily fulfill for you to actually sit for the exam. Okay, so you will need to have completed all your end posting evaluation, and it needs to be satisfactory. The scope of your logbook and the number of cases needs to be satisfactory, and the numbers also needs to be satisfactory. Again, I will come to it later. In terms of others, usually we have to look if there's any comments, any particular concerns that the trainers have on you. Okay, and based on all of these things, and also we also look at things like in others, we write the case write-ups and as well as the CPD portfolio. Now, in the comments, we will write either satisfactorily completed, and the recommendation is to proceed with training or to proceed for exams. Okay, recommend to proceed for exam. Or if let's just say we feel that you lack 1, 2 things. For example, maybe you lack a few surgeries like a lap chole or a thyroidectomy or maybe a embolectomy. We will say to try and get a thyroidectomy or a lap chole before sitting for exam, of which this will be highlighted to the head of general surgery, and we will brought up in the division just so that this is fulfilled before they submit your names for exam. If you do pass, okay. If let's just say we feel that this there's a lot of issues. For example, there's issues with your posting assessments, your case write-up is not complete, your logbook has severe deficiency, and a lot of trainers have put into the form that they are not ready, they do not think they are safe to be a general surgeon and to take the exams. We will then put that under our recommendation to actually discuss this in a meeting first before deciding what to do. Okay, so as you know, this is usually a 6-monthly assessment, but by the end, it'll be 2 to 3 trainers in general surgery. It's done either face-to-face or online. Again, let me reiterate to you, we look at your logbook, your consolidation sheet, your case write-up, and also your 3-monthly evaluation, and also the courses which you have attended. So please make sure when you come for the meeting, you have all of these things. okay? Especially the LOPO and consolidation sheet. Please make sure you hand it up at least 1 week earlier and do not make us chase it for you, all right? 1 time, 2 times, I think okay, but I think the next time, if this comes to it, we will just not talk to you during the evaluation. Maybe just have a new appointment or even cancel the evaluation in the first place, because this is very important. Now, candidates flagged up will be discussed further with the master's coordinator for remediation action if necessary. Now, to come quickly to the logbook, because I know most of you will have questions, what are the index cases that we need, how many do we know that is enough? Now, previously, it's variable, the surgeons will sit there and then you see what are the number of cases which makes you think that you are safe. Recently, we have come up with a national postgraduate curriculum, and it is being submitted now, and this is actually with KKM, with other universities and our university as well, and likely that's going to be adopted, but it's not in your training program. But this is probably going to be what we're going to base our number of cases and also index of cases on. So very quickly, just to touch on it, okay. For example, we will need index procedures. So what are index procedures which you must have? When you finish masters, you are phase 3. Okay, the numbers that you see there, 5, 4, 5, 5, 5, those are the skill level that you're supposed to acquire. So for example, you're supposed to do OGDS independently, laparoscopic appendectomy independently, hernioplasty, PGU repair, stoma, okay, index procedures. So these are must-haves, okay? All right, things like small bowel anastomosis, right hemicolectomy, mind you, right hemicolectomy, mastectomy, thyroidectomies, laparoscopic and open cholecystectomies, this can be supervised. Laparotomy for trauma, you're supposed to do it independently. And for femoral embolectomy, again, is actually supervised, okay? So these are index procedures. Now, all this coming on are the recommended ones for you to have, and also the number, the stated skill level, and the number that you need to have. Now, for example, here in neck surgery, I know a lot of you probably wouldn't have this, okay? But for example, you need a skill level 5 of lymph node biopsy, probably there's no issues. Tracheostomy, a lot of you will be doing already. The rest 3, basically, we're not too strict about that. Breast surgery, for example, you need to do good number of lumpectomies, wide local excision, and also drainage of breast abscess. Even mastectomy, those cases are you're actually doing under supervision, Thyroidectomies, most of them are 4 and 3s, which means still under supervision. As you can see, not that many also, thyroidectomy 2 and then hemithyroidectomy 3. Thoracic surgery, thoracotomy under supervision 2. Hernias, we expect you to be able to do at least 10 already, which I'm sure a lot of you that have done more than that. Your prior umbilical hernia and so forth. Colorectal surgery, as you can see here, independent ones, we only expect you to do things like large bowel anastomosis and also right hemicolectomy, and just small bowel resection, probably Hartmann's also. I mean, these are all run-of-the-mill general surgery, in order for you to become proficient general surgeons and safe general surgeons. These other cases as well, ileostomy, colostomy, and so forth. Upper GI surgery, I think the most important one here would be things like your PGUs. Gastrostomy you're supposed to be able to do as well. HPB, supervise at least 2 lap colis and 2 open colis, and the rest just mainly either management, just either assist, or you can do it supervised, things like splenectomy. Vascular surgery. Now, I understand that most of you might not have the practical experience or also fulfill the logbook. Mind you, this is just recommended, okay? The trainers will actually adjust to the situation. I mean, all of us know it's COVID for this past 2 years, and depending on the center that you go, the number of cases always changes, and also the number of people always changes. A number of, they might be actually junior surgeons who just started off, they might be taking all of the cases. So we will take all these things into account as well. Okay, so at the moment, I would say this is not cast in stone. All right, but at least this will give you a guide of what you need to achieve, or what you should try to achieve. Like, of course, index procedures, you need to achieve them. Okay, urology is here, neurosurgery is here as well, but you can see nothing which is really independent. Pediatric surgeries, just herniatomies and hydroceles. Okay, emergency procedures, these things like appendix, you should be able to manage complication appendectomy as well, laparoscopic appendix, and so forth. Endoscopy shouldn't be a problem for you to do OGDS and subcolonal independently, 50 and 20. Plastic surgery for you to do skin graft. Okay, now just to show you an example of the kind of logbooks that I get. This shouldn't be the type of logbooks that I get. I don't think it's very reasonable. You can see here, when it comes to year 4, there are certain cases which in the consolidation sheet is not there. Okay, number one, first of all, the skill level summary is all doesn't follow the template that we give. Okay, you can see there's no mastectomy, there's no excision of breast lump at 4th year, you know, there's no anterior resection, there's no transverse colostomy, there's no hemicolectomy, there's no colectomy, you know. And then if you look further down, look at this. There's nothing on hepatobiliary surgery. How are we supposed, there's trauma surgery is completely empty at year 4. How are we supposed to let you go for exams like that? Obviously, it is impossible, isn't it? So be mindful, look at your own logbook before coming to the final clinical evaluation. I think most of you, I want you guys to take your clinical evaluation seriously, because recently we have stopped a few people going for exams. Okay, and I think it's time for you guys to take this seriously. All right, be serious about putting the cases in. Be serious about updating your logbook. It is not a joke. We take it very seriously nowadays. Okay, I think that's all for my slides. Are there any questions?